Bismillah ar-Rahman ar-Rahim. Our topic today is about vaginal discharge. And first of all, we will speak about the item leukorrhea. Leukorrhea, by definition, it's excessive, white, usually it's translucent, but excluding infection, it's non-purulent, and for exclusion of bleeding, it's non-sanguineous vaginal discharge. So just a clear, translucent, white, excessive vaginal discharge. Not with pus and not with bleeding. As regards causes of leukorrhea, it may result from pelvic congestion, mucus polypi, hyperestrogenic state, and in the premenstrual period. Clearly, in the hyperestrogenic state and the premenstrual period, it's under the effect of estrogen and its effect on the vaginal discharge, making it more excessive and translucent. Pelvic congestion and the mucus polypi can cause the increasement in the normal vaginal discharge to be named as leukorrhea. As regards the pathological causes of the vaginal discharge, 95% of the vaginal discharge is because of infection, and the commonest infection regarding the vulvovaginitis is the candidal infection. Clearly, it is the fungal infection by the Candida albicans. The discharge is very characteristic by being scanty and purulent and whitish curdy discharge. As regards the Trichomonas vaginalis is a protozoal infection and it causes profuse, greenish, frothy discharge. Both candidal infection and the trichomonal infection are associated with inflammation of the vulva and the vagina, so it can cause pruritus vulvae and it can cause redness and the other signs of inflammation. And the lastly is the bacterial vaginosis. Bacterial vaginosis are mixed bacterial infection by the Gardnerella vaginalis organism, which is usually one of the normal bacterial flora or normal commensal in the vaginal discharge, and it's characteristic by certain vaginal discharge which is grayish discharge and with offensive fishy odor. Usually it's not associated with other manifestation of inflammation like burning or pruritus vulvae. Maybe other causes of vaginal discharge: cervicitis, foreign body, viral infection, or chlamydial infection. Of course, with foreign body, it's associated with purulent vaginal discharge. Vaginal discharge can be classified according to its character, maybe into mucoid discharge, which is just clear mucus, which is the same causes of leukorrhea by mucus polypi, pelvic congestion, or hyperestrogenia. Maybe it's mix of mucus and pus, like mucopurulent discharge in cases of cervicitis, especially by the gonorrheal infection, or maybe yellowish offensive discharge, which can be caused by foreign body. Sometimes this infection may be resulted from severe or heavy infection of Candida or Trichomonas or bacterial vaginosis. But if you are mean by yellowish offensive discharge pus, it's very characterized by or very characteristic for the foreign body. So if you are speaking about yellowish offensive discharge, maybe the trichomonal or bacterial vaginosis, but if you are speaking about yellowish like purulent discharge, it is very characteristic to the foreign body. Sanguineous or bloody discharge may be caused from atrophic senile vaginitis, ulcers, mucus polypi, vascular erosions, and neoplasms. Clearly, it's because of the bleeding of the local vaginal or cervical lesion, or maybe offensive discharge, maybe the poor odor from the foreign body, maybe from malignancy, maybe because of abnormal communication between the GI and the vagina, like the rectovaginal fistula, sometimes in cases of pregnancy with infection such as septic abortion or puerperal infection. Water discharge can be caused from just urinary fistula, just this water is urine, maybe intermittent hydrosalpinx, maybe hydrorrhea gravidarum, molar pregnancy, cystic degeneration, and some types of malignancy. Here we will speak about a certain algorithm for diagnosis of abnormal vaginal discharge. First of all, history. History taking, we will ask about the marital status. Maybe multiple partner is associated with sexual transmitted diseases. Sometimes related to the parity, maybe it's related to certain erosions or tears postpartum, and the characters of the discharge, as we spoke later or spoke earlier, that maybe if it is curdy, cheesy, whitish discharge, maybe this is of candidal infection, profuse, watery, and frothy with offensive discharge. Maybe it's trichomonal infection, or if it is grayish, moderate amount, offensive, characteristic fishy odor, it's of the bacterial vaginosis infection. Then we will take a sample from the discharge, but with certain precautions, which is 24 hours at least before sample there is no douches. We should use sterile speculum examination for avoiding or to avoid the contamination of the discharge, and after taking the sample we can check for the characters that we spoke about it earlier and the pH. After checking the character of the discharge and the pH, we can do the fresh drop examination. Simply you get a sample or a drop of the vaginal discharge and mix it with a drop of saline under the microscope. If you just see mobile flagellated protozoa, you can diagnose trichomonal infection, or if you find the claw cells, which is just the squamated vaginal cells, this is diagnostic for bacterial vaginosis. And if you can add to the vaginal discharge 10% of KOH solution or potassium chloride, potassium hydroxide, you can smell the odor of the fishy discharge, which is characteristic for the bacterial vaginosis, or under the microscope you can see the pseudohyphae and the spores, so you can diagnose for candidal infection. You can also use the gram stain, and you can see the gram negative intracellular diplococci, which is for gonorrheal infection, or you can by the gram stain other bacterial infection. If you put a vaginal discharge or a mass or a sample of it on a certain media, you can have a culture from the organism. Maybe if it's candida, you can culture them on Nickerson or Sagarot's medium. Gonorrhea, maybe with the chocolate agar or the Thayers-Martin medium. Gardnerella infection can be cultured on the Kazman agar. Other aerobic or anaerobic media for other stains, for other types or other strains of bacteria. And of course chlamydia cannot cultured on a simple media, it needs a tissue culture to be cultured. There are some serological tests can be done by a sample from the female serum to check some infection like syphilis by the VDRL, gonorrhea by complement fixation test, or lymphogranuloma venereum, which is certain type of chlamydial infection, by PCR. Other types of investigation, you can use the vaginal cytology, biopsy from a certain lesion or ulcer to exclude malignancy, urine and stool analysis for parasitic infection, plain X-ray for foreign body, or cystoscopy in cases of urinary fistula. Thank you very much.